Jamaica, like the rest of the Caribbean, has a very heavy burden from non-communicable diseases. It's the #1 group of diseases that causes disability and death. And most importantly, it causes a lot of these deaths to occur before the age of 70. And that's really where the focus of our concerns are, because these are diseases that are diseases of older age. And in North America, for example, people die of heart attack and stroke in their 70s and 80s, while in the Caribbean and in Jamaica, they're dying in their 40s and 50s. And we have great concern about that because, of course, these people are in the prime of life and losing too much years of life. Okay, so I spoke a little bit about the man problem because men, by nature of their lifestyle and their environment, are exposed to more risk, and also some of the choices that they make. So they have more dangerous jobs, yes, but they also drink more, smoke more, and less use of the health services. So many men will tell you that if they feel really, really sick, it's the only time they'll go to the doctor. This idea of going for checkup and checking their blood pressure and so on, not really part of the male culture. So you find that you hear a lot of stories about men in their 40s and 50s, sudden death. And usually this is because of some undiagnosed chronic disease. So what we need to do about this is partly what we've been doing here today, which is to raise consciousness among partners in society. We need an all-of-society response because this really is not a health issue. It's an issue for all of society. And the partners who we had at this meeting here today, the media, faith-based organizations, civil society organizations, health NGOs, and so on, those are the partners who we need to work with so that we can influence their constituencies to adopt more healthier behaviors. But let me just quickly say that it's not just a simple matter of people's self-will or self-control. It's very important, the environment in which people live. So for example, if you have facilities that are available for safe and pleasurable recreational activities, people will take advantage of that. We see that over here in Independence Park. People are there in their hundreds in the afternoons. Also, in terms of the kinds of foods that are available, there are different kinds of fast food. Some are healthy, some are not. So we need to educate people to go towards the healthier foods. Childhood obesity is a problem in Jamaica, and like in the rest of the Caribbean, it's being driven by marketing. There's a lot of marketing of unhealthy foods that is being geared towards children. But in addition to that, you know, with this new lifestyle, everybody's on the go, it's easier to just buy unhealthy foods in a package or a soda with lots of sugar and give to the children. Very often it's cheaper too. So the challenge to us, as we said in the meeting, is to find affordable, delicious, healthy food. And that really is a challenge. We're going to have to work on that because what's available in the market very often is what people will have. We also are going to have incentives in terms of price. So we need to make unhealthy food more expensive.